Good morning. Welcome back. Thank you for doing this one with me. I know I've been hammering you on all these question and answers, so I appreciate you making the time for me again.
Yeah, no, these are fun. Thank you for having me.
Yeah,
I
absolutely.
appreciate it.
So for everybody watching, this is Dr. Maria Guzman. If you haven't seen any of our previous conversations, they're really worth watching. I'll put some links to those as well as a link to her website, which is dreamlifemedical.com. Dreamlifemedical.com. I'll put that up as well as in the description. You can click right on it. You do telemedicine, you're sleep focused, but you also do quite a few other things. And
Yeah,
you want to do a real brief
absolutely.
description on that, at least let people know who you are and what you do.
Yeah, it's a direct care specialty practice. I'm a sleep specialist, also trained in obesity medicine and mind-body medicine. So I take a whole person approach to helping people identify the root cause of their sleep conditions or weight health challenges, addressing stress as a big contributor to metabolic dysfunction and
Mhm.
sleep issues, insomnia. Of course, ruling out things like sleep apnea. So it all goes together, and the goal is to address the root cause.
Okay. Yeah, what we wanted to talk today to you about was the link between sleep and testosterone, and does CPAP affect that at all? And just in general, like I don't quite understand it. And I'll tell you a funny story. Over the weekend, I have a barbecue team called Barbecue My Way. I don't get too creative, right? But we actually won overall in the brisket category, which is super cool.
Oh my
And
gosh.
it's we got called up there, and I'm sitting with my family. I start crying like a little 10-year-old girl. It's hilarious, right? Everybody's making fun of me. When we get done, my buddy's like, dude, you gotta go get your blood work checked. I think you might have some low T.
Oh
So
my goodness.
so maybe I need to get some updated blood
Yeah.
work. But
My brother loves smoking brisket, so maybe he needs to
ah,
join your team and get up with that.
yeah,
But
I'll
yeah,
I'll send him
I
my
think
recipe. There's no secrets. So it's I don't know, and I'll be honest, I don't know that championship brisket is like what I would serve to my family. It's so like overdone, you know what I mean? But you certainly wouldn't want to have to trim it for your family. That's a lot of waste and it's way too much effort. But
yeah, I've
I'll
learned
give it
how
to you.
it's a whole science. It's a whole
Oh
thing.
yeah,
So
genuinely
I
science. Like
commend
you're
you on your on
It's
your
it's funny how
winning.
you have to concoct some things, but we won, and I cried like a little girl. So I think I'm gonna get my testosterone checked next week. But maybe it's just because I wasn't sleeping. So if you would describe a little bit to me, like how when you make testosterone, in my brief understanding of it, that happens, I think, mostly during sleep. But if you'd give
Mhm.
me the science behind it, that'd be super cool.
Yeah, I think a lot of our endocrine and immune system, our defense system, and our hormone system is regulated during sleep. And some hormones are regulated based on like the circadian rhythm, like melatonin is made in the evening, cortisol is made in the morning. But some hormones like growth hormone and testosterone, thyroid a little bit, are dependent on the quality and the amount of sleep that you get. So they are made by the brain and stimulated in production based on, for testosterone, for example, uninterrupted sleep. And so it seems some data shows that 3 hours of uninterrupted sleep is what it requires for your brain to start prioritizing that hormonal gonadotropin releasing hormone, all of the precursors to eventually get the gonads to produce testosterone.
Okay.
And so it's a very complex system, and sleep absolutely impacts it.
I feel like I've heard that cortisol thing in reference to testosterone. I've got a buddy who's a nurse practitioner, and that's all he does is blood work for people and TRT, testosterone replacement therapy and stuff.
Yeah.
Um, and I feel like he mentioned something about cortisol too.
It's a
What?
pathway where the hypothalamus tells the pituitary gland in the brain, so all of it starts at the level of the brain to activate the adrenal glands, which produce cortisol and the stress hormones, adrenaline. So that stress axis is what we call it, hypothalamic pituitary axis. So it goes from the brain to the adrenals and from the brain to the gonads, the ovaries in women or the testicles in men. And so those two pathways start kind of at the same place in the brain. And depending on your physiology, whether you're sleeping or if you're in a state of fight or flight, a different pathway will get activated. So the brain, of course, in a state of survival, it's going to increase stress hormones. It's going to go down the cortisol pathway. It's not going to prioritize reproduction, right? Reproduction requires a state of calm, of like, okay, everything's okay in our environment. We can activate the sexual path of reproductive health because we, as a species, that's what, nature does. But those two pathways are kind of they combine at the level of the brain initially, and the brain is in charge of assessing what part of your physiology it prioritizes at any given point. So that's how they're connected.
Okay.
Is if you're in a state of stress, your hormones are not going to prioritize reproduction.
So the higher the cortisol, probably the lower your testosterone. Is it with the
Potentially, yeah, potentially.
okay? Yeah, I feel like that a buddy of mine had done his blood work with him, and he has said that his testosterone was fine, but the cortisol was high, which caused maybe free testosterone to not be available or something like that. I'm probably butchering what he told me.
Yeah, I think it's a complex metabolic health uh, pathway, right? So, for example, excess body weight, excess adiposity will increase the levels of the binding globulin that attaches to testosterone. So there's less free testosterone. So potentially in a state of excess cortisol, we have excess body fat accumulation. And so all of that kind of goes hand in hand. But really, based on the guidelines, what we look at is total testosterone when we're looking to see what needs to be replaced.
Okay. Um, and so it's made in sleep, and you said you need like 3 to 4 hours. Is that a 3 to 4 hours uninterrupted?
It seems uninterrupted sleep, 3 hours is what a study quoted in terms of getting that peak testosterone production. But I think it depends. I think uh, I don't think we can say like that's an absolute.
Hmm.
It's hard
Is
to test that kind of
is
thing.
there a window of like let's say I sleep 7 to 8 hours? Is it like the first 3 to 4 hours or the last three
Mm.
to four hours, or is it like, you know what I'm saying? Like, is there something
Yeah,
to
that's a
that at
good
all?
question. I think so. For example, with growth hormone, it's made mostly during N3, stage three sleep, and so that happens more at the beginning of the night. I would presume testosterone may be similar, but I'm not sure exactly. Like if it varies depending on um, the time of the night. I have read that REM sleep is also important for testosterone. So potentially more we get more REM at the end of the night. That's
Hmm.
rapid eye movement sleep, where we tend to dream, that kind of thing.
And so you
So,
would need
so I would
potentially the
say
full
throughout the
seven,
night,
maybe.
probably.
Okay, all right. Interesting. Then, obviously, if you've got sleep apnea, which is what we deal with a lot, that's got to have some effect on it, I would presume.
Yeah, a couple of things can cause the association between sleep apnea and testosterone levels being usually lower. And one of those is when you have sleep apnea, you have low oxygen states, right? So frequently throughout the night, multiple times per hour, your airway is closing, oxygen drops, and it creates a state of fragmentation. So your brain has to arouse you, you get that gasp, you may not be aware of it, but that sleep fragmentation and low oxygen state creates a stress to the body.
Hmm.
So, in a state of stress, your brain is going to prioritize breathing, getting the oxygen back up to normal. It's less likely to prioritize reproductive health. And so, in that sense, we're fragmenting sleep, we're not having uninterrupted sleep. And therefore, I think the production of testosterone will go down. The other thing is that in patients who have sleep apnea, often there's excess adiposity or excess body weight. And again, there's a correlation between overweight and obesity and having low testosterone levels. And to treat that, the first line treatment is weight loss, not testosterone replacement.
Okay. And how would, obviously, if somebody's got sleep apnea and they're continually waking up, they should treat that. Has there ever been any studies that like see if somebody starting CPAP increases testosterone or anything like that?
Yeah, they have tried to look at that. It's the data is kind of vague in response. So some studies suggest maybe in people who have severe sleep apnea where the oxygen saturation gets very low, very frequent episodes of fragmentation. It seems that in those patients with severe disease, there is an improvement in testosterone levels upon starting CPAP. But some other studies don't suggest that. And so I think it depends on the severity and there's variation from person to person. In general, the weight reduction when we start to treat obesity and treat the sleep apnea if it's present, we tend to see more of an effect there with testosterone going back up. But
Hmm.
CPAP, it's kind of hit or miss.
Okay. Yeah, I on that, I guess the counter to that is I know some guys that are even a personal friend that's a big time bodybuilder, like maybe not a bodybuilder. What do you call the people that show
Yeah,
I don't know, they
bodybuilders.
flex, they get super lean, I don't know what I can't, it's a bodybuilding competition or something. I
I
don't know.
think so. Yeah, yeah, strongman or
Yeah,
whatever.
we've
Yeah.
got a few like some people that just do like what I guess I'm getting at is we've got some high testosterone fellas that are on CPAP with us, and they are like very serious about being on their CPAP. One of them even did a video for us. My buddy Fonzo is on the our YouTube channel talking about how he uses CPAP in relation to his bodybuilding competitions. I think it's called a bodybuilding competition. But should somebody that goes on testosterone, now these guys are probably outliers, I presume they're big guys, and if you're a big guy, you probably there's a very significant chance you're going to need a CPAP. But it's not like they're out of shape or anything. They're in phenomenal shape. They're just big guy. But is that in reference to testosterone at all? Like if somebody starts testosterone, should they get tested for sleep apnea, or is that just like obviously these guys are extreme, but I don't know. You take it from there if you would.
Yeah, I think it's probably one is if there's sleep apnea, we absolutely want to treat with a CPAP, right? The energy improvements of, cognitive function, a quality sleep, improving muscle recovery. I think that's really important in an athlete. And so prioritizing the quality of the sleep that you get is important. But yes, so when we start to screen for testosterone deficiency, one of the screening tests that should be done is checking to see if there's symptoms or evidence of sleep apnea. Often a sleep study is recommended before starting testosterone. Because if there's I think moderate or severe sleep apnea, it's actually contraindicated to start testosterone. We
Hmm.
know that testosterone will make it worse. Testosterone affects the regulatory part of the brain that regulates breathing, and so there's more likelihood of worsening sleep apnea when we don't treat it first if we start testosterone. So it's a contraindication. Testosterone has other risk factors, right? It can increase red blood cell production, can increase the risk of clotting, potentially stroke, potentially heart attack. And so um, it's important to screen for something that is treatable, like sleep apnea, which would worsen that cardiovascular risk if we were to worsen the disease and start on something that increases overall health risk, right? So screening is important. And of course, if sleep apnea is there, treating that. And when we diagnose low testosterone, there's a pathway of checking for that. It requires two fasting levels of testosterone and blood work. It has to be done at the same time each day because we want to check it in the morning. Testosterone varies throughout the day, like other hormones, like cortisol, for example. And so the way that we test is very important to ensure that we are definitely confirming the deficiency of testosterone, whether it's from a secondary cause like sleep apnea, for example, or if it's a primary cause of like hypogonadism, like the testicles are not producing enough testosterone. So it's more complex than just checking a free testosterone level and then
Yeah.
starting.
So if a guy's considering TRT, he probably ought to get checked for sleep apnea as well, basically.
Definitely.
Um, where was I going to go with that? So if a guy, I guess most of my friends, I'm at the age where everybody's considering TRT. I don't know what it is, between that 40 and 50 mark, everybody's like, I want to be young again. Um, I think it's mostly like from people saying like, I'm tired or I don't have the energy I used to.
Mhm.
I've had my blood work done a few times and I've never been low or low enough. I'm like in the middle, to ever consider it. My selfish reasoning would be like, I feel like if I had higher testosterone, it'd be easier to stay in shape. But I think most guys are because they really want to just have more energy, like they feel lethargic or sex drive or something of that nature.
Yeah.
And if you have sleep apnea and you start TRT and you're still tired, I mean, I guess if you're starting TRT and you haven't checked for sleep apnea and you're still tired, probably a slam dunk thought process would be get tested for sleep apnea.
Absolutely. Absolutely.
Okay. Yeah, there's a TRT clinic that actually was asking us quite a bit because they have so many of their customers that need to get sleep tested um, after starting TRT because they're starting TRT for the fatigue. And then well, according to the lady that owns the clinic, they are still tired after starting the TRT.
Yeah.
Like not much has changed. And
Yeah.
then they get them tested for sleep apnea, find out they've had sleep apnea the entire time. So I don't know what the cart before the horse would be on that. Like it sounds like you're saying you probably ought to get tested for sleep apnea before you really go too far
Yeah.
down the TRT road.
Yeah, before prescribing testosterone, we want to do our due diligence and I address the root cause of symptoms, right? So fatigue could mean a lot of things, and they do correlate with each other. The symptoms of sleep apnea and the symptoms of low testosterone and testosterone deficiency are fatigue, low libido, erectile dysfunction, exhaustion, poor concentration, brain fog, difficulty concentrating, right? Unrefreshing sleep. And so it's our due diligence as medical providers to screen and address what could be contributing before adding a medication that has other risk factors. And people do feel better on testosterone, right? But as we take testosterone, we are suppressing our own endogenous production of it. And so you kind of get stuck taking it and it will dysregulate your endocrine production in the long term. And so before prescribing something that you're going to need potentially long term, because the moment you stop taking it, your testicles are no longer producing it to the same degree, then we have to do our due diligence and screen for the things that could. And fatigue is so many things, right? There's physical fatigue, there's mental fatigue from overthinking, from the mental load that we carry nowadays, right? There's emotional fatigue. And so we have to kind of break that down and say, what is the cause? And let's check everything before we start treatment.
Yeah. Yeah, I think I've listened to enough Joe Rogan episodes where I think he says it's the plastic in the water or something like that's causing all of this. But I think it's more probably a cumulative effect, right? Like however many tens of millions of people in America have sleep apnea, how many tens of million people are overweight. And so it's probably more the cumulative effect, I would presume that's because I guess it's an I'm going to use the wrong word, epidemic of people having lower testosterone, right? Or something that like it's a trend, a downward trend or something.
I don't know the statistics of the prevalence of testosterone deficiency, but I think culturally there is a overdiagnosis of it
Hmm.
because people feel better on it, right? And so
Yeah,
it's
and
easy
it's a
for.
lifelong deal, right? So like you got a customer for life. When somebody goes on testosterone, they
And
don't
so
come
I
off of
think
it, right? Like in most scenarios.
Yep, I think like the weight loss industry, diet industry, I think there's a lot of money to be made on,
Hmm.
and unfortunately, like depending on the company and what their clinical
Sure.
standards are for practicing evidence-based medicine, because this is medical treatment and we're seeing like med spas that where you can get it, right? The same thing with the GLP-1s for weight management. I've had patients that go and say like, I just paid $300 and they gave me a vial of semaglutide and like nobody checked my vitals, my weight. And I'm like, where are your medical records? This is a
Oh,
medical
no.
treatment. And so there is just a lot of people out there doing things that I mean, I'm a physician. I practice evidence-based medicine. And so we don't put money as the primary reason why we do what we do. But there are people out there that certainly do.
Yeah. So if a guy made an appointment with you to get tested for sleep apnea based on this conversation, maybe even, and would you ever advise him or have him go do blood work for testosterone after being like crossing the bridges you described as needing to be
Yeah,
crossed for?
absolutely. Let's say you start somebody on CPAP. We diagnose sleep apnea. We start on CPAP, and still we're having that lethargy, tiredness, fatigue, poor concentration, low libido. That warrants a workup for testosterone deficiency. And so that
Okay.
would look like getting two fasting blood levels at the same time in the morning. And based on that, we would do additional workup looking at the pituitary hormones like LH, FSH to see if the pituitary is sending the right signals to the testicles to produce testosterone. And so it requires this whole endocrinology workup, which, I can certainly help start. And if there's anything there that suggests pituitary concerns, that would require like an MRI of the brain. Sometimes, it's a whole workup. So sometimes I would, if there's anything concerning, send somebody to endocrine to work up the causes a little bit in more detail. So again, a lifelong treatment, and so
Yeah.
we want to do our due diligence. But yeah, I'm happy to order the workup and get people started, and again with evidence-based medicine on what the next step is. Is this the right thing for me?
Okay. Yeah, that's fair enough. I've always kind of thought of it that way because I had given it some consideration in the last year, just because it seems like it'd be like the easy button. You know what I mean? That for me anyway. If you double my testosterone, I'm probably gonna have to work out a lot less. And
I mean,
I don't know
this
if
is
that's true or
the
not, but it feels that way.
This is under the realm of an endocrinology specialist
Okay.
that should be working this up and addressing and treating. And if you have symptoms, like that's a sign to do the workup. But I do recommend like doing it with someone that's like has your best interest at heart and not
Sure.
necessarily the financial piece.
So not just because I want to get jacked.
Right.
Okay.
Yeah.
That's fair.
I
Okay.
mean, it's a controlled substance for a reason, right? It can be
Yeah,
misused. It can be overused, misused. It essentially, and it has health risks, and that's why it's controlled.
sure. Okay, cool. Well, I feel like that gets all of my questions out of the way. It is an intriguing topic, and it's so relevant. Like so many guys, I'm going to tell you honestly, I bet I'm going to maybe 25% of my friends my age are doing TRT now. Like, and maybe that's too much. Maybe I'm exaggerating it, but they're at least considering it. It's a big thing for guys now
Yeah.
because to me, just from my perspective and why I would have considered it, is it feels like the easy button. You know,
Yeah.
I'm not going to have to really worry about the cause. Let's just pump myself full of testosterone. Is that called exogenous or something like that? It would,
Yeah. Exogenous
um,
testosterone.
yeah,
External.
and not worry about it, you know. And no offense to anybody that does it. I don't. I just it was a
Yeah.
lot to. I don't want to do something that I have to do every day for the rest of my life if I can help it. And that's which is why I consider testosterone. I'm gonna have to work out every day. Maybe I wouldn't have to work out every day, but anyway, I appreciate your time and I appreciate
Yeah.
the info. Anything else you'd add to the conversation before we let you run?
No, I think it goes back to the societal culture that we live in right now, right? Where we want the instant gratification. We want to go through the drive-through. We want things to be as easy as possible. And so there are people out there saying like, I can make this easy for you. Like, all you got to do is come in. And I try in my practice to empower people to check in and figure out like how do I optimize my own physiology? What do I need to take care of myself in a way that feels like it's me, like I'm empowering myself to do things and take care of my body because we don't need all the external stuff if it's not indicated, if it's not necessary. We want to empower ourselves to do everything we can on our own to fuel our body well, to optimize our muscle health. And that means working out. And so we can't escape these things, but how can I implement movement and strength training into my life in a way that's enjoyable, right? And maybe that you can incorporate like your kids and your family into it and go rock climbing or do something where it's like you're not even working out. You
Mhm.
don't think that you're at the gym exercising, right? But you're doing the strength training. And so that's what I love to empower people to do because we can do a lot for our own health. I'm a big proponent that self-care is healthcare and improving our relationship with our body, with ourselves, with our emotions. All of that is more impactful than any medication I can give in certain cases. I'm just speaking broadly.
Mhm.
But yeah, that's how my practice is different.
Cool. And that's
You might
Dream
just
Life.
learn that you want to work out a little bit
Yeah,
more.
good. So it's dreamlifemedical.com if somebody wants to look you up and maybe start that conversation.
Yeah. Thank you so
Okay.
much, Glenn.
Yeah, yeah.
Appreciate it.
Thank you for making time. I
Always
know you.
enjoyed conversations with you.
Yeah, I'm sure we'll do it again. Thank you very
Yeah.
much.
All right.
Yeah,
Enjoy your weekend.
you
Thanks.
too.